assessment and charting. There are three main elements to a cardiac exam: inspection, palpation, and auscultation. Before any of this, we want to gather some past medical history on the patient. This includes history on hypertension, high cholesterol, diagnosed heart conditions, lifestyle factors, family cardiac history, and current chest discomfort. We then observe for chest deformities, or JVD. The jugular vein will tell us about cardiac function, and at a glance, we should not be able to see this vein distending out of the skin. Normal charting would be the external chest is symmetrical with no scars, signs of trauma, or cardiac devices, no evidence of JVD. Next is palpation. We can place our hand in two places: over the left chest to feel for any vibrations or buzzing known as thrills, or over the apex of the heart to locate the point of maximal impulse. This will tell us of any cardiac hypertrophy. Normal findings are charted. PMI is not visible and is palpated in the fifth intercostal space at the mid-clavicular line. No thrills noted. And lastly, auscultation. We've got 5 landmarks here. Reference my heart sound assessment video for details on this.